Okay. Good afternoon, everyone. It's great to be with you this afternoon. Thanks for joining us for the Emory Living with Dementia webinar series. This series is a sponsored and supported event by the Emory Cognitive Neurology team and the Integrated Memory Care team. I am Jenny Gay. I am the clinical social worker for the Integrated Memory Care Clinic here at the Brain Health Center. I'm joined by my wonderful colleague, Ashley Varner, who is the lead social worker for, I believe, all of cognitive neurology. And we put on this presentation the second Wednesday of every month from 12 to 1 virtually. And we try to pick topics and different offerings that are relevant and meaningful and important for you all as caregivers and as people moving through this disease process to learn and join with us in these presentations. I am going to hand it off to Ashley to introduce our wonderful speaker today, Anita Alvarez, who is a Medicare specialist. And we're so happy to have you with us today.
Thanks so much, Jenny, and thanks y'all for attending. I am really excited to introduce my colleague, Anita Alvarez Richards, who was formerly with the Senior Health Insurance Program. If you're not familiar with that program, it is a wonderful offering from the state of Georgia that helps all seniors who are interested in Medicare figure out which Medicare, how to navigate Medicare, number one, and then which part of Medicare is going to be the best fit for each individual given what they have going on in their own lives. So it's a really amazing program, and most importantly, it's nonpartisan, non-biased. So it's just getting the really concrete information, whereas brokers can sometimes have agendas that we are not aware of. So with that, I'm going to hand it off to, I'm going to set up Anita's PowerPoint and then hand it off to her.
Good afternoon. I want to thank you all for allowing me to come and talk about Medicare for you guys. I'm going to tell you about how to get ready for Medicare for next year. Sorry, guys.
Just for everyone's knowledge, while we're moving through the presentation, while Anita is speaking, if you want to put your questions in the Q&A box, we can answer those at the end or however Anita wants to handle questions.
Yeah, we can answer them at the end.
Okay.
There's a lot of information to go through, so I'm going to go through it as quickly as I can. I think that most of you are already on Medicare, but I want to just give you a quick information on what it is. Medicare is a federally funded health insurance program for people who are U.S. citizens or resident visa holders who've lived in the United States for 5 consecutive years. It's for people who are 65 and over. Some people who are under 65 with certain disabilities. Is for people of all ages with permanent kidney failure requiring dialysis or kidney transplant. And it's for people who have received Social Security disability for at least 24 months. Now, one thing people seem to misunderstand is they think Medicare pays for everything. Medicare does not pay for everything. They pay for part of the cost for medically reasonable and necessary healthcare services. Medicare has an 80-20 rule, meaning that they will pay for 80% of medically reasonable services, whereas the beneficiary will pay for the other 20%. That is really important to know. Now, there are 2 main coverage choices. You can do what's on the left side of the screen, where you do original Medicare. That's going to be your Medicare Part A hospital or your Medicare Part B medical. That's what you're going to see on your red, white, and blue Medicare card. Now, those services do not cover drug coverage. So if you need additional drug coverage, you can get a Medicare Part D plan. And some people choose to get a secondary coverage to pay for that 20% that Medicare doesn't cover. That's going to be things like a Medigap plan, maybe retiree insurance or union insurance, or it could be Medicaid. Now, I like to call that a la carte. You may have insurance from 3 different companies. You may be paying 3 different premiums. On the right side, this is your Medicare Advantage plans or your Medicare Part C. These are bundled plans like HMOs, PPOs, SMP, which is a special need plan. These are the plans that you see people talk about on TV a lot. Right now, there are a lot of commercials, and they're trying to get people to enroll in these types of plans. So these are your 2 coverage choices, and then you would want to decide which one works best for you. Now, what does Medicare Part A and Part B cover? Part A is going to be hospital insurance. It's going to cover hospital inpatient care. It's important to know it does not cover observation. I don't know if any of you have ever been in the hospital under observation, but you can be in the hospital, in a bed, in a room, and be under observation. That's where they're going to do testing, they'll do screenings, but they may not have a formal diagnosis so that they can formally admit you yet. You can definitely ask the healthcare team, or you can ask the social worker on the floor if you're under observation or formally admitted. Whichever one you're under, that will determine which part of Medicare is going to pay for that service. Now, Medicare Part A also covers skilled nursing facility care. If you have been in a hospital for 3 full days, not under observation, and you've been in that hospital for 3 full days, also not counting your discharge, we may transfer you to a skilled nursing facility for further care. It covers drugs that are part of your inpatient care. It covers home health care, hospice care, and blood. Now, your Part B insurance, that's going to be your outpatient services. It's going to cover services from doctors and other healthcare providers. It will cover your observation. If you go into an emergency room and you are not formally admitted, it'll cover that. It will cover some home health care, durable medical equipment like walkers, wheelchairs, hospital beds, things like that. And it'll cover preventative services. If you have a Medicare and You 2023 or 2024 book, it's going to cover those services. And it's really important to get those screenings and services done. And it'll also cover kidney transplant services. Now, Medicare Part B immunization coverage, I'm going to go through this really quick. It will cover COVID-19 vaccine and boosters, and you will not have to pay anything for the COVID-19 vaccines or their administration. No copay, no coinsurance, or no deductible. It will cover your flu shot, and right now you can get your flu shot and your COVID-19 vaccine or booster at the same time. It'll also cover your pneumonia shot and your hepatitis B shot. And starting in 2023, the following vaccines are free to beneficiaries enrolled in Medicare Part D or a Medicare Advantage plan with prescription drugs. That's going to be your hepatitis A, hepatitis B, your RSV, shingles, and your Tdap. Now, what's not covered, it doesn't cover any concierge care, cosmetic surgery. It doesn't cover any services from a doctor who may opt out of Medicare. It does not cover routine dental care, eye exams, hearing aids, long-term care, or private duty care. A lot of people do think that Medicare covers that. Medicaid sometimes covers that, but not Medicare. It does not cover massage therapy, routine physical exams, or routine foot care. Now, Medicare Part C, this is what we're getting ready for now. Medicare Part C, or the Medicare Advantage plans, are offered by private insurance companies approved by Medicare. The plans have to cover the same services Medicare covers. So what these plans do is they take your Medicare Part A and your Medicare Part B, and now they cover those services. With these plans, you're always covered for emergency and urgent care. And for additional cost, some of them may offer drug coverage and other benefits such as dental, vision, hearing, telehealth, or custodial care that can help you with your daily activities such as dressing, eating, and personal care. This is what we're seeing on all these commercials right now, the Medicare Advantage plans. With these, benefits and cost sharing may be different. So your deductibles, co-insurance, and co-pays may be different. So just as an example, you may have company ABC, and they may sell different plan types. They may sell a HMO, a PPO, a special needs plan, or another type of plan. With those, they sometimes go by silver, gold, bronze. Same company, different services, and they may charge you different deductibles, co-insurance, or co-pays. So it's really important for you to look at your options before choosing any one plan. With these, you do have to have Medicare Part A and Part B. Again, they cover both. You cannot have one or the other. You do have to live in that plan's geographical service area. And no, not all plans are available in all areas. So the plan that may be available in your area may not be available in your neighbor's area or your friend's area. It depends on what your zip code is. You can enroll, change, or switch plans during open enrollment each year. That's October 15th through December 7th. So right now it's October 11th. We can look, but don't touch. You can go onto the Medicare.gov website. You can call the Georgia SHIP, or you can ask a friend or family member to help you look at your options. But starting on October 15th, you can actually enroll in an option. Now, if you're enrolled in a Medicare Advantage plan during the Medicare Advantage open enrollment period, that's January 1st through March 31st, you can change or switch plans once and get a new plan, which will begin the next month. Or you can go back to original Medicare and or a drug plan between January 1st to March 31st, and the new plan will begin the next month. So what happens a lot of times is people will enroll in a Medicare Advantage plan during this season, October 15th to December 7th. Come January 1st, they may find out that their doctor will not accept their new insurance. If that happens, then you can switch to a different Medicare Advantage plan, or you can go back to original Medicare, which is just A and B, and then you can switch to a drug plan. Before you do get on any Medicare Advantage plan, if you love your doctors, make sure that your doctors and your hospital will accept your insurance. A lot of times people switch insurances without asking, and they don't find out until it's too late. One example would be Kaiser Medicare Advantage Plan. They are a great insurance. They are a 5-star, meaning they have the best insurance that Medicare will offer. However, you can only go to Kaiser physicians and Kaiser hospital facilities. You can't go to Emory or anywhere else with that insurance. So you definitely want to make sure before you get into the insurance that your providers or your hospital is included in their network. Now, if you join a Medicare Advantage plan during your initial enrollment period, you can switch to another MA plan or go back to original Medicare within the first 3 months you have Medicare. That's a special enrollment period. You can also switch to a 5-star plan once a year. So what Medicare does is they take these plans and they look at the different criteria. How good is the plan? Which prescriptions are they covering? What services are they covering? What is their customer service like? And then they rate them based on star ratings. Again, 5 is the best. And you can look it up on the Medicare.gov website, and they'll tell you what the star ratings are for each plan. So if you get on a plan, you don't like it, you want to switch to a 5-star plan, you can do that once a year. The new insurance will become effective the following month. And then other circumstances may apply, like maybe you left your job or your insurance went away. You cannot switch because the provider left the plan. Sometimes providers will be in an insurance network, and then they may decide to opt out at any time. Because the provider opts out does not mean that you can change. You just have to find a new provider within that plan. Now, what are the costs? With a Medicare Advantage plan, you still have to pay the Medicare Part B premium. I don't know what the premiums are going to be for 2024. That information usually comes out around November timeframe, but just know you will have to pay that Part B premium. If you have low income, you may qualify or be eligible for state assistance. You know that many do require an additional premium. However, it would be lower than Medigap. Now, there is the Give Back program. For next year, the Give Back program, they will give you back anywhere from 10 cents to whatever the full Part B monthly premium is per month, depending on the plan. Now, this does not depend on your income. With this, you do have to pay your Part B premium. You have to be responsible for paying that. You do have to live in the service area of the plan or the program, and income again is not a factor. It is credited monthly on your Social Security check, and it could take up to 3 months for activation or deactivation. So again, you may have company ABC, and they may have 3 or 4 different plans. With one of their plans, they may give back $100 a month. With another one of their plans, they may give back only $50 a month. Or another plan, they may not give back anything. So you want to look and see what their programs offer. Again, if you decide to go with one of those plans, activation does take up to 3 months. So don't expect to see anything immediately. If you get out of one of their programs, deactivation could take up to 3 months. Okay, you do pay deductibles, coinsurance, and copays. And for 2024, the maximum out-of-pocket costs are up to $13,300. Now, this is different from original Medicare. With these, they cannot charge you higher than original Medicare for certain care like chemo, outpatient dialysis, immunosuppressant drugs, or skilled nursing care. But they can charge you more for services like home health, durable medical equipment, or inpatient hospital services. So with these, if you go with the HMO, you definitely have to stay in your network. You cannot go outside of your network. You will probably have a flat rate that you're going to pay. So if you go to your primary doctor, they may charge you $25. If you go to a specialist, they may charge you $50. You would have to look and see what the benefits are. If you go to a PPO, they're going to charge you a little bit different because you can go in and out of network. So if you go to a PPO instead of a flat rate, they may charge you a percentage. So for your primary care, they may say, okay, you have to pay 10%. Or if you go to a specialist, they may say you got to pay 25%. And a specialist could be any kind of doctor. It could be a neurologist. It could be physical therapy. It could be any kind of doctor or provider. So you want to look at those services and those costs. When you get ready to look at your plans, look to see what the out-of-pocket costs are. Once you reach the out-of-pocket cost, you will not have to pay any more, but just know you will have to keep paying until you reach those costs. And know that plans do vary from plan to plan. They do not stay the same. Medicare Part D prescription drug coverage. This is offered to everyone on Medicare. It is a voluntary plan service. However, if you do not enroll in this plan when you are first eligible, you can face a penalty later on. So let's say that you're just turning 65 and you don't feel like you need to enroll in a Medicare Part D plan because you're not taking any medicines or you're only taking vitamins and supplements. If later on down the road, you end up having to enroll in Medicare Part D, then you could face a penalty. And that penalty is 1% of whatever the national average is at the time, times the number of months that you could have been enrolled, but you were not enrolled. Let's say that you enrolled in a Medicare Part D plan when you were first eligible and you used it for a couple of years, but then you decided you didn't want to keep paying the premiums because you weren't using it anymore. 5 years go by and you decide to re-enroll. Well, even though you were enrolled before, the fact that you disenrolled and didn't use it for 5 years, they're going to penalize you for those 5 years that you did not use it. And the penalties that you will pay will be for the rest of your life. So I tell people, even though it is a voluntary program, get on it anyway. Even if you have to get the least expensive plan, get on it so that you will have some kind of coverage in case you need it later on. Now, like the Medicare Advantage plans, these plans are offered by private insurance companies approved by Medicare. And the benefits are provided either as a standalone plan, which is a PDP, or through a Medicare Advantage plan, which we refer to as a MAP, a MA, or MAPD. Eligibility for Medicare Part D, you have to have Medicare A or B to enroll in Plan D. You don't have to have both unless you enroll in a Medicare Advantage plan. You do have to live in the plan service area, and you can enroll, switch, or change plans during open enrollment each year, which is October 15th through December 7th. Now, I said earlier, if you have a Medicare Advantage plan, you can change plans between January 1st and March 31st. That does not apply to the standalone prescription drug plans. So during this period, you really want to look at your options to make sure you get in the right plan, because you are going to be in that plan for the rest of the year, unless there is a 5-star plan available in your service area. And then again, special circumstances may apply, like the plan may go away, or you may lose your insurance for another reason. What is covered under Medicare Part D? Medicare Part D covers brand name and generic drugs, biological products and insulin, and the supplies associated with injection or inhalation. Insulin drugs are capped at $35 per drug per month, and it covers all commercially available vaccines except for those covered under Medicare Part B. Now, beginning in 2024, there will be a $8,000 out-of-pocket cap for people with high Part D cost. I know a lot of people right now are in the donut hole, well, the former donut hole. It's really hard to explain because Medicare said they were getting rid of the donut hole. So right now, it's still there, but you're only paying 25% during that time. So what this is doing is it's going to say once you reach $8,000 out of pocket, then you're not going to have to pay anymore. Now that cap is going to lower to $2,000 starting in 2025 and onwards. So for people who have very expensive medicines, which are going to be the specialty drugs or the injectables, those kind of drugs, you're still going to have to pay up to $8,000 in order to get to the other side, which is catastrophic coverage, until 2025 when they lower it to $2,000. For these folks, I would say try to get extra help. Know that that Medicare is extending the eligibility for extra help. Extra help is a program through the Social Security Administration. You can apply for it, and if you do qualify, They will help you pay for the cost of your medications. They will help you pay your deductible, and they'll help you pay your premiums. A lot of people think that they won't qualify, so they don't even try to apply. But I tell everybody, apply anyway and let Social Security determine whether or not you qualify or not. Now, effective January 1st, 2024, they are going to lower cost at the pharmacy counter. A lot of people are afraid to talk to the pharmacist. They're afraid to ask the pharmacist if there's a way to get their medications at a lower cost. People will just bypass getting their medicine because they're afraid to talk to the pharmacy. They do have a little area where you can have a pharmacy consultation. Use it. Go to the pharmacy, talk to them about the medication, ask them if there's a way to lower the cost of your medication. Medicare Part D cost for 2024, the monthly premium average is going to be $55.50. You can shop around, and I recommend that you shop around. There may be premiums that are lower, there may be premiums that are higher. Note, just because the premium is higher does not mean that the program is better. So you definitely want to shop around. The deductible is going to be $545. So in most plans, you are going to have to pay that $545 before the plan pays anything. After the deductible, you're going to go into the initial coverage period where you're going to pay 25% of your copay or coinsurance. That's going to be up to about $5,030. Then you're going to go into what we call, again, the former coverage gap or donut hole, where you'll pay 25% of your copay or coinsurance. And then when your out-of-pocket spending reaches up to $8,000, you're going to reach the catastrophic benefits period. This is going to be the fourth period for this program. And during that time, you're not going to pay anything. Now, this year, you are paying up to 5%. So you'll continue to pay up to 5% until December 31st. This program where you pay nothing doesn't start until 2024. What's not covered under Medicare Part D? Anorexia, weight loss or weight gain medications, cosmetic or hair growth, the relief of cough or cold symptoms, sexual or erectile dysfunction. Medicare does pay for Viagra, but not for that reason. Vitamins and minerals, no non-FDA approved and no over-the-counter. You may get like a drug card or a drug discount card from the insurance company, but that is not Medicare Part D. That's just a benefit that they're giving you for being a member of their plan. Leqembi, I hope I'm pronouncing that right. Leqembi Alzheimer's medication is approved by the FDA in 2023. It is a biologic designed to slow Alzheimer's progression by identifying and attacking beta amyloid proteins in the brain. It's administered by an infusion through a vein in your arm every 2 weeks. So every 2 weeks, you would have to go to your healthcare provider's office or an infusion center to get this medication, and the infusion lasts about 45 minutes to an hour. Now, it is for individuals with early stage Alzheimer's or mild cognitive impairment. It is not approved for treating more advanced stages or for individuals who don't show any symptoms. The current price is $26,500 annually. Medicare Part B will help pay for the medication. However, individuals will have to pay their 20% copay, which is about $5,300 per year. And that is after meeting the Medicare Part B deductible. Again, I don't know what the Medicare Part B deductible or premiums are going to be. That won't come out until next month sometime. The annual open enrollment period, I can't say this enough. October the 1st through the 15th, right now, you can compare your coverage, you can look at your options, you can look, but don't touch. Starting October 15th and going until Pearl Harbor Day, December 7th, open enrollment, you can enroll, you can disenroll, you can change your Medicare plan, you can change your Medicare Advantage plan, you can change your Medicare prescription drug coverage. You have lots of options and choices to look at during this fall. Now, I do know people who every few weeks they're looking at their options and then they think something better comes out and they keep changing them. The last option you choose is going to be the one that Medicare is going to enroll you in. So if you choose an option on October 15th, and then you talk to your friend who said they found a better option, and you decide on October 30th to switch to the better option, and then you talk to your family member who says they found a better option, and on Thanksgiving you switch to that better option, well, Medicare is going to enroll you in the very last one that you enrolled in. And you'll be receiving new plan information on that last one. Your coverage will begin on January 1st, New Year's. Hopefully you will have your new card in hand and your new plan information. January 1st through March 31st is the Medicare Advantage open enrollment period. During that time, you can change or switch to another Medicare Advantage plan, or you can leave your Medicare Advantage plan and go back to original Medicare and possibly join a Part D standalone plan. Your coverage will begin on the 1st of the month after your enrollment. If you are not enrolled in a Medicare Advantage plan on January 1st, you cannot take advantage of this enrollment period. You have to be in a Medicare Advantage plan on January 1st to be able to do this. And again, once per year, you can switch to a 5-star plan if one is available in your service area. Now, the plan finder, you or your family member or friends can go to Medicare.gov website. You can look at the Medicare Plan Finder. You can put in your personal information or not. I go on that site a lot and I do not put in my personal information because I'm not 65 yet. But you can put in your personal information and it will save that information for you. You can enter and review drugs by name, dose, and quantity. You can select pharmacies within your service area. You can review search results and you can compare plans right there. It'll let you choose up to 3 plans. You can look at them side by side. You can see which one is better for you. And if you want to, you can enroll in a plan right then and there. If you don't want to, they do have the plan telephone number that you can call, and you can call the folks up and enroll that way. Or you can call our Georgia SHIP and they will help you select a plan that is best for you. Comparing plans, Medicare plans do change their cost and coverage of services. So you may be in a great plan right now. You might be in plan ABC and you've got the best coverage. They're covering all your medications. You love your doctors. But then next year, they might change it. They might decide not to cover all your medicines. Or maybe they've decided that they want to service another area. Those things happen. So even if you love your plan, you still need to look at it and review it against other plans. Know that the Medicare drug plans, whether it be a standalone drug plan or a Medicare Advantage plan, they do change their medication tiers. And they do change what medications they choose to cover. So let's say right now you might be on losartan potassium or Cosar. And in your plan, it may be a tier 2 medicine. Well, next year they might change it to a tier 3 medicine. Or let's say that you're on simvastatin. Your plan may cover it this year, but your plan may decide not to cover it next year. They are able to do these things. Now, they're supposed to send you a letter in writing at least 60 days before they change the tiers or before they decide not to cover it, but they can do that. If you get into a plan that has decided to stop covering your medicine, or if you're on a plan and your doctor or provider prescribes a medication that he or she thinks you need to be on and your plan will not cover it, you can get your provider to write a letter to your plan to tell you why, or to tell them why you need to be on that medication. And the plan will review it and they should cover that for you. Okay. Now, again, some plans may choose to leave Medicare and new plans may be added. They come and go every single year. When I first started doing this in 2005, we had 80 something plans. Now we're down to about 20 or 30. So they come and go, they change their services, they change their providers, coverage changes. It is very important for you to look at these options every single year. So other things that you want to consider is the cost. How much does the plan cost? What is the deductible? What is the premium? What are my copays and coinsurance going to be? And what are my total out-of-pocket expenses going to be? What coverage do they offer? Remember, they have to offer everything that Medicare Part A and Part B cover, because they're really just taking that Medicare Part A and Part B and they're managing it for you. You're not managing it anymore, they are. Are there any additional coverages? Do they offer home care? Do they offer transportation? Do they offer dental or vision? Prescription drugs, that's important. Don't choose a plan that does not cover your medications. Again, doctor and hospital choice. Quality of care. Can you get your insurance providers on the line if you need to? Are they covering all the services that you have requested? I tell people when you go to a medical appointment, take paper and pencil with you so you can write down the services you had done. So when you get your bill, you can make sure that you are being billed for the correct services you've had done. Sometimes the providers or their billing people make a mistake and put in the wrong number or the wrong code, and you may get billed for something you never had done. Travel. If you're in a HMO Medicare Advantage plan and you travel outside of your service area, the HMO is not going to cover it if you go to a medical appointment, unless it's an emergency. If you're in a PPO and you travel, they'll cover it. Just know that you're going to pay your percentage of coinsurance. So know what those are. If you have other coverage, like from an employer or a union, check with your plan's benefits administrator before making any changes to your coverage. And if you choose a plan outside of your coverage, you could lose your coverage for you and your dependents, and you may not be able to go back. So if there's anyone on here that has retiree insurance through their organization, work with your benefits administrator before going on a Medicare Advantage plan or before coming off of your retiree insurance, because you will not be able to go back once you're off. For people who choose to go with original Medicare A and B and get a secondary insurance, there's options such as Medigap policies. Now, these are sold by private insurance companies approved by Medicare. So with these insurance companies, they're going to be big companies like Blue Cross Blue Shield, Humana, Cigna, Aetna. These insurance companies sell all of these insurances. They sell the Medicare Part D plans. They sell the Medicare Advantage plans. They sell the Medigap plans. They sell life insurance plans. They sell all different kinds of plans. So if you decide to talk to someone I would recommend going through an agency like Georgia Ship versus going through a broker. The brokers are going to try to talk you into the plan that they're wanting you to go with. If you go through an unbiased person, they're going to talk you or help you to choose a plan that's best for you based on your needs. Now, with the Medigap plans, these plans are called Medigap because it fills in the gaps that Medicare doesn't pay, which is that 20%. With Medigap, you do have to have Medicare Part A and B. It can't be one or the other. There are 10 standardized plans, and they are labeled by the alphabet. So with Medicare, they're labeled A, B, C, and D. With these plans, they're also labeled A, B, C, D, all the way up to letter N. You don't want to get this confused with the Medicare. The rates do vary depending on what services you want and depending on which plan and company you go with. If you see something that says Medigap Select, these policies may require the use of certain physicians and hospitals. They're going to be network plans. Any other Medigap plan will follow Medicare anywhere Medicare goes in the United States. So enrolling in a Medigap, the best time to enroll is 6 months following your enrollment in Medicare Part B. You cannot be turned down for any reason during that time. They cannot charge you more because of health problem, and they cannot make you wait for coverage to start. For people who are under 65, you do not have guaranteed issue rights. You will be subject to pre-existing conditions. The company is not required to sell beneficiary policy, and you'll be given open enrollment period at age 65. So for people who are under 65 and who are on Medicare, when you turn 65, that is going to be the best time for you to get on a Medigap plan. You will have more options and you will not have to pay more. If you're under 65, your options are going to be limited and you're going to have to pay a lot more, kind of like if you were to go on Cobra, how they double your premiums. So I would recommend waiting until 65 and getting on one of these as soon as possible, if that's something that you're interested in. I'm not going to go through each of these plan types, but it is in the, are these going to be handed out? Okay.
They'll be online.
Okay, this will be online, so you can look at the different plan types and the services that are available, and it will show you how much percentage that they pay. Now, Medicaid is a federal state partnership health insurance program for low-income older Americans and some others on limited income. It is based on your income or assets. It is different from state to state. So if you come from Alabama or New York or Florida and you're on Medicaid, then you'll have to qualify for Medicaid in the state of Georgia. Some states do allow for custodial care. It does cover long-term nursing home benefits. And then the Medicare Savings Program pays Medicare premiums and possible additional co-insurances. That's going to be your Quimby, your Slimby, and your QI. If you don't know if you qualify for any of these, I recommend going to your local Department of Family and Children Services and applying, and then they'll tell you if you qualify for any of these programs. Skip that. I'm going to talk about it this way. The 2023 Community Care Services Program, this is what they call the CCSP. It is an elderly and disabled waiver program. It offers community-based services as an alternative to nursing facility placement. It's going to offer things like adult daycare, emergency response services, homemaker services, personal support, home delivered meals, and other. Now, this does not cover the cost of room and board. So you would have to pay for that out of your pocket. Income and assets for a single person monthly income is $2,742. For a married couple, it's $5,484 if both spouses are applying. If you're married and one spouse is applying, your monthly income is $1,371. And your assets for a single person is $2,000. Married, it's $3,000 if both spouses are applying, and it's $2,000 if one spouse is applying. Now, you are allowed to keep a certain amount of money. I believe it's $10,000. You are able to keep that aside, earmarked for burial expenses. Income and assets for the community spouse or the well spouse. This is so if you have one spouse that needs nursing care, but then the other spouse is independent, doesn't need any kind of help. It's so that that person can live in the community without jeopardizing the Medicaid spouse. So that monthly income is going to be a little bit different. They're allowed to have $3,715.50 of their own income. And if that's not enough, then they're allowed to take some of the Medicaid spouse's income to get up to that amount. The spouse of the Medicaid recipient may also keep as much as $148,620 in assets without a hearing or court order. So when they're looking at your income and assets, they're not looking at the house that you live in, they're not looking at the car that you drive, and there are some other things that they are not looking at. A lot of people do not apply for CCSP because they don't think they're going to qualify. Again, I recommend that you do apply. Let Georgia tell you if you don't qualify, but go ahead and at least try it to see if you can get help paying for the services that you need without having to go into a facility. Another program is SOURCE. This is service options using resources in the community. Now, SOURCE offers also community-based services as an alternative to nursing facility placement. The same things: adult daycare, emergency, homemaker services, personal support services, delivered meals. In this program, nursing home level of care is required. The applicant must be eligible for SSI. And again, it does not cover the cost of room and board. Your income and assets are going to be a little bit different on here. Monthly income is going to be $914 for a single person, $1,371 for a married, both spouses applying, $1,371 married, one spouse applying. Assets, $2,000 for a single person, but assets, $3,000, whether you're married and both spouses are applying or married and one spouse applying. If you reside in a personal care home, so there are homes that may house 3, 4, 6 people. That's a personal care home. It's kind of like an assisted living, except it's a house where you have only a few people living there. Single person must pay $726 a month towards cost of room and board. You are able to keep $188 a month as personal needs allowance. Married people, both spouses on Medicaid, must pay $1,009 a month towards room and board. They are able to keep $303 a month as personal needs allowance. SOURCE does not allow a non-applicant spouse to retain a larger portion of the couple's income and assets. So SOURCE is a little bit different from CCSP, whereas with SOURCE, they don't count the community spouse. For more information on this or to apply, you can contact the Division of Family and Children Services office, and I do have the number on the slides that you can call. Where to report fraud and scams? I have to tell you that I live out at Lake Oconee, and this past year, there have been so many older adults who have been getting the COVID scams. They've been getting billed on Medicare for COVID and the COVID kits and all that, and they didn't know what to do. If something happens to you and you need to report fraud or scams, you can contact any of these agencies and they should be able to help you. Adult Protective Services, the Do Not Call Registry, sign up for that if you can. Elder fraud, the FBI, Federal Trade Commission, Georgia Senior Legal Hotline, Medicare fraud, Senior Medicare Patrol, Social Security fraud. Stop direct mail, stops all that junk mail from coming to your home, and then stopfraud.gov. Watch out, read your statements, make sure that you're not being billed for services that you did not receive or for any products that you did not receive or sign up for. And for people who can help you with Medicare, again, call Georgia SHIP, formerly Georgia Cares. They now go by SHIP. They are available Monday through Friday from 8 to 5. I do have the phone number on here, and I have a link to the website on here. Are there any questions that I can answer for anyone?
Anita, that was such a wonderful presentation. I do have a question for you. I don't see any in the Q&A box, so I will go ahead and ask. Are you well versed on the new guide model that is coming out and how that relates to traditional Medicare and or an Advantage plan, and kind of what the implications are of choosing a plan as it relates to guide?
To the new guide coming out? I'm not sure. I haven't heard of that terminology.
Okay, so the guide program, I'm certainly not the most expert person on it, but it is going to be a program specifically for providers delivering dementia specific primary care. And it will only be accessible through the traditional Medicare plans. It will not be available through the Advantage plan.
I will have to look into that and get back to you guys. And I need to know that myself. So thank you.
It's an exciting new thing happening, but
and it's called Guide.
Guide. Yes. Thank you so much. Sorry to throw a curveball at you.
No, I need to know those things, and all of my research and everything that I do on Medicare, and I work a lot with CMS, Center for Medicare and Medicaid Services, and I've not heard of this.
You should definitely look into it, and I would love to know your thoughts on it, but you are such a wealth of knowledge, and this was a fantastic presentation.
Well, thank you. Any other questions, comments, concerns?
So there's a question in the chat. I'm here with Anita, so I'm off camera, but there's a question in the chat about will this recording be available? Yes, y'all. I am very excited to say that we have all of these now up on available via YouTube, all of the dementia webinar series programs going back for 3 years. So I will, this one will probably, it takes a little bit of time for them to get uploaded, but it will be up, and I will send out the link to it with the November invitation. So the links to all of these with the November invitation. If you need it before then, if you want the slides before then, as long as it's okay with Anita, absolutely. I will, if you email me, I will be glad to send them to you. Okay.
Wonderful.
If there are no other questions, then we will give you all back 5 minutes of the hour. Thank you so much for joining, and please tell your friends and family and anybody who's interested in these topics or has particular things that they want to hear about. Please let us know. We really want this program, this webinar series, to meet y'all's needs.
Thank you, guys. I appreciate it. Have a great rest of your day.
Thank you so much.
Thanks.